Welcome back to Untold Physio Stories podcast. I'm your host, Dr. E, with Modern Manual Therapy, Edge Mobility System, and my new private network for PTs, The Eclectic Approach. Make sure to check that out at members.theeclecticapproach.com. My co-host, again, not with me. Someday we'll get back together. Today I have a very special guest, Dr. Ryan Martin, who's going to come on the podcast today and tell how he got into MSK ultrasound.
Yeah, thank you. I appreciate you inviting me onto this. That means a lot to me.
Yeah, well, apparently this is some kind of crazy story or not crazy story, so we'll see. How did you get into MSK ultrasound as a PT?
It's not really a crazy story. Long time ago, when I moved to Phoenix, Arizona, I had an opportunity to oversee quite a few pain management type clinics on the physical therapy side. And so I would bounce between all the different clinics, and sometimes I would help treat patients, a lot of administrative work. One day I got caught into one of our downtown offices, and they asked if I could help treat some patients. And I said, yeah, absolutely, I can do that. I can come in, I can help out a little bit. And they said, all right, well, let me give you a little backstory on this patient. There's some psychiatric issues that you're going to have to be aware of. And I said, oh, that's fine, I understand. The treatment room that we used is, and again, these were kind of a box in a box type scenarios where they'd put like a little PT room inside a pain management clinic. And so it wasn't really like a large room. So just to give like an environmental awareness, it was maybe like a 8 by 8, 9 by 9. It was not a big room at all, with a plinth table, just the setup was just very small with some small, just some small exercise stuff in there. So what happened was they said, okay, you can go in there. He's with his wife. Just kind of do an evaluation and see what's going on. So while I'm sitting there with him, he's already kind of agitated and rocking back and forth and just showing some telltale signs that he didn't really want to be there. Um, Halfway through the discussion that I was having with him, the MA kind of walks into the door and says, hey, Ryan, can I close this door? We're having an issue out here. So apparently in the waiting room, which was actually conjoined to that room, so you basically had to walk through the waiting room straight into this room. So you didn't go through a reception or anything like that. You just went from the waiting room straight into this room. And so what happened was a gentleman in the pain clinic in the waiting room had a seizure and had passed out right in front of where I was treating. So they needed to close the door and box me into this room with this gentleman. So again, you could imagine when the paramedics came and everything happened, I was locked into a room with someone that they had afterwards explained to me had bipolar schizophrenia. And he did, and while he was sitting there, also mentioned that he was claustrophobic. So I was stuck in this room with a very large, a very large individual. He was probably, well, again, as I tell the story, he probably gets bigger. So he was like 7'4". No, he was like, 6'2", but not a small frame at all. And I was getting very nervous sitting in there with him, and I was so not wanting to be in there. Anyway, all was good. Another 30, 45 minutes after the paramedics left, um, you know, he left, everything was good. He signed up for more PT, which was good. But at the end of it, so I was talking to the MAs and everybody that was going on. I said, well, hey, what happened out there? What was going on with this patient? And they said, oh, he OD'd. He had a drug-induced issue. And again, this was quite a few years back. We don't have to go into a lot of detail of the opioid, epidemics and things like that, but it was right in the heyday of all that kind of stuff. And so what this person was doing was they had come in possibly seeking pain meds, and had OD'd right in the lobby. Now, I don't know the overall outcome of what happened to the patient. He was taken out. And so anyway, the final kicker of this story was, he had left his medication bottle on the counter. The patient that had OD'd had left his medication bottle on the countertop. And so the MA went to go pick it up, and she felt it, and she said, this is liquid in here. What is this? And so she opened it. The guy, again, I'm trying to say like stay PG here, but the guy had urinated into a cup, or had somebody urinate into a cup that he could use to fill into our lab testing to make sure that he had nothing in his system. Well, everything back obviously backfired. He had, OD'd in the clinic, and the MA unfortunately had urine all over her hands. It was just a hodgepodge of just bad, bad day. So let me explain how this all fits into MSK ultrasound. Like,
I
hey,
know.
Ryan, I thought
I wonder. I'm wondering that right now.
so you're thinking to yourself, wow, he said he was telling us about how he got into MSK ultrasound. Now, here's how it all relates. A week prior to that, a gentleman by the name of Jared Bowen had come to me and said, "Hey, Ryan, um, have you ever thought about doing ultrasound in your practice?" And I said, "Yeah, I took modalities. I understand." He said, "No, no, no, not therapeutic ultrasound, diagnostic ultrasound." And I looked at him. I said, "I'm not a radiologist. I don't. What are you talking about?" He had kind of summed up everything about MSK ultrasound to his knowledge at that time. We're talking quite a few years ago. And he told me, if you're interested in this, reach out to me. Let's talk. Let's see where this goes. And I said, you know what? I'm overseeing a bunch of clinics. I'm a director. I'm doing so good. I'm happy. One event had me calling him the next day and saying, "Hey, you know what? Can you talk to me a little bit about that MSK ultrasound?" So I had basically that moment in time, just really kind of put things in perspective. Like, hey, I need to do something different. I want to see what else is out there, and the rest is history. So we met up. I met up with some really awesome people. I started learning MSK ultrasound. I started doing conferences. I got certified, and this is what I do now. This is what I love. This is my passion. But I can say that there was pretty much one defining moment in my healthcare career that said, okay, I can't do this. I need a change. And that was my story. So it's not so crazy. It's not out of control, but it definitely had some twists and turns. That was it. So
Well, that's awesome. I mean, so it was more like the onus was you just thought I want something more than your 9 to 5 clinic job, or
yes,
even
that was
even as a
exactly
director,
it.
because you weren't even actively seeing patients, right? Because you were mostly doing overseeing other clinicians, right?
Yes.
Yeah, yeah. Well, that's
Yeah, it was
great.
just
I
that
mean,
yeah, it was
especially for
that
a
point in time where
non-clinician.
yeah, exactly. So it was just one of those moments in time where he said, yeah, it's you know what? I see a road, like a road, a fork in the road. All right, let's go this way. Let's see what happens. And you know what? I'm super happy that I did.
Awesome. So how long have you been doing MSK ultrasound now and teaching it?
So I guess that was probably around 2015, 2014 that I had that idea, and since then. And so once I contacted that gentleman, Jared Bowen, and he got me connected, I was scanning pretty much right away in a sports med facility with a physician that was RMSK certified. So basically, like right off the bat, I was put into a sports med clinic, and I was doing all the scans with a couple other experts. So I was able to, get all the requirements so I could sit for the board pretty quickly. So that's how that happened. Yeah.
You got those 150 cases pretty quickly.
Oh, yeah, really quickly. And we were talking about this before, is that's one of the tough barriers for MSK ultrasound.
Right, right. Yeah. What Ryan was telling me before the mic started rolling was that the you need 150 cases to be reviewed um, as one of the requirements. And I just said, I don't know, even know if that's practical for me, like for the rest of my entire career, if I could get 150. But he is actually working on that, and it would be possible now for me. It just wouldn't be possible with my current caseload, but it would be possible with some of the ways that he is working on it. So, if you guys are interested, where can people learn more?
About what I'm doing.
Yeah,
So honestly, my LinkedIn is really kind of my platform. I don't have any other social media. I'm working on that. Also working on a YouTube channel, thanks to inspiration by certain people like you. So I want to do a podcast and I want to do that kind of video stuff. But realistically, my LinkedIn is really my format to where I connect with a lot of people. Other than that, if you're interested in the education side of things, I have a education website that we have outside of our clinical stuff, which is amsku.com. It's the Advanced Musculoskeletal Ultrasound Center, and so that's where I do all my education formatting and stuff like that. But if you want to reach out to me, LinkedIn's really the go-to.
Right, and that's how I found you too.
Yes.
Well, that is a great origin story. So, if you guys ever have any interesting physio failures, great cases, or hilarious patient encounters, make sure to reach out to Andrew or myself on social media and get on the podcast. Make sure to subscribe on Apple, Google, or Spotify, wherever you listen to podcasts. Give us a 5-star rating, and please share the podcast so you can help us grow. And as always, you guys have a great day.